And doctor, how is an acute lymphoblastic leukemia different from an acute myeloid leukemia?
So that's another very smart question. So a acute lymphoblastic leukemia we call like as ALL, or acute myeloid leukemia, which is AML. Those are two types of blood cancer. Origination, they primarily differ with the cell of origin. Acute lymphoblastic leukemia originates at the lymphocyte level. Acute myeloid leukemia originates at a myeloid level. Lymphocytes and myeloid cells are both different types of white blood cells. So it's a complication or malignancies of white blood cells where they multiply and become very like an immature cell multiplication, and they proliferate and occupy the bone marrow and leads to malignancy, cancer, ALL or AML. They do differ in terms of diagnosing them. In terms of treatment, AML has slightly more aggressive treatment, which is more inpatient based. The outcomes are slightly different for AML than the ALL. So acute lymphoblastic leukemia is highly curable. Acute myeloid leukemia is also very curable, but their cure rates are slightly lower than acute lymphoblastic leukemia, but still very curable. So there are nuanced differences on how we would treat it. The length of treatment would vary. The medications we use to treat these cancers would vary. So it's extremely important to diagnose leukemia at the right subtype level. So not all acute leukemia are the same. There is a pre-B cell acute lymphoblastic leukemia. There is a T cell acute lymphoblastic leukemia. There's an AML and there's an APML. These are like a few different types of acute leukemia. There are a few more. So it's important to identify the right subtype because each of them have minor variation in how we will treat them.
Mm-hmm. Thank you so much, doctor. And could you tell us a little more about the treatment, like how long it lasts and what are the general side effects of it also?
Yes, it's very so ALL is a prolonged treatment. So that treatment lasts for around 2 to 3 years. It's a large treatment, but the first 6 to 9 months are slightly more aggressive treatment, which require multiple visits to the hospital to get chemotherapy. Most of the treatment includes chemotherapy, different types of chemotherapy, which are administered through a central line. Patients would have a central line and they would get treated with this. The side effects of this chemotherapy includes nausea, vomiting, hair loss, to sometimes severe like infection or sometimes organ compromise as well. So we have to monitor the patients while they get this treatment very carefully and frequent with the right cancer doctors to manage this. While the treatment is long and there are some side effects of treatment, majority of the patients will be able to beat the cancer and really become victorious and become a long-term survivor. In ML patients, those treatment is more inpatient based and lasts for around 6 months instead of 2.5, 3 years with ALL. But this is a treatment which they are staying in the hospital and staying there and continuing their treatment in the hospital-based treatment. So they stay in, get one type of chemotherapy for over a week, and then they wait in the hospital to get recover. Or sometimes they let them go home, depending on the center you're getting treated at. So I don't know, but it's like really differences in nuanced differences in how we would treat them.
Thank you so much, doctor.